Now moving on to more local news, BC's new health minister was in town on Friday and sat down with CFTK-TV. On Friday we saw part one. Now here's part two from Jaylene's conversation with Minister Josie Osborne.
What about addressing doctor and nurse burnout?
Yes, that's a serious issue, and workplace conditions are a big part of that. Our healthcare workers go above and beyond each and every day, and certainly during the pandemic, we saw that. We really celebrated the work that was done by healthcare workers, but we have to continue that too. And so addressing those issues around stress, anxiety, fatigue, with bolstering the number of people. And again, we're in this global healthcare worker shortage. So we have to continue to attract, incentivize, bring in new healthcare workers, physicians, nurses, create safe working places, make sure that there are enough people, that roster or complement of people, particularly in a small community where you need the right number of people so that if somebody is sick or somebody goes on vacation, that it doesn't increase the burden on everybody else who is there. So we are using travel nurses as well who will come in and help to alleviate some of that, but we really want to build the local complement because I know rural communities especially want people to live in their community and be part of it, and their kids go to school and they shop locally and they really become part of the community.
Yeah, they do. And so do the family doctors. I know that's another struggle in Terrace is having a family doctor.
Yeah.
Is anything being done to address that?
Yeah, absolutely. And so again, the work to create more doctors through the new medical school and expanded seats at UBC, for example, working with locums to attract them into rural areas in particular to help cover off some of those shifts as we build the complement of doctors. We've attached 900 new family doctors, and we've got about 680,000 people in BC since 2018 that have been attached to a family physician. So there's momentum. We're going in the right direction, but at the end of the day, each and every person who wants that family care or primary care provider, whether it's a doctor or a nurse practitioner, that's their doorway into the medical system, and having that is a really important thing. So that's why we're going to stay very, very focused on that. It's one of my top priorities, certainly as the new health minister, to do everything we can to have those primary care providers in communities across BC.
Interesting, yeah. And I know one thing our local MLA Clarote mentioned is that the healthcare system, in her words, struggle with a lot of paperwork. Is that going to be reduced?
Yes, absolutely. Administrative burden is something doctors certainly have made very clear to us is something that they want to reduce, and we're working with them to do that. So we've made a commitment, for example, to reduce or eliminate unnecessary sick notes. So that's something we'll be working on in 2025 and looking at options and working with the doctors to make sure that we do it right, because of course we want to make sure that we are doing it right. But even things like getting rid of fax machines. It's kind of hard to believe in 2024 that we're still using fax machines. But again, working with the doctors, with nurses, with clinics, with the health authorities to reduce that administrative burden is a top priority as well.